Hello and welcome to the Canadian Digestive Health Foundation's presentation of IBD Protocols for Maximizing Your Health. My name is Catherine Mulvale and I'm the Executive Director for the Foundation. Thank you for joining us this evening. The Canadian Digestive Health Foundation is here to help you. We are the foundation of the Canadian Association of Gastroenterology and are supported by physicians and scientists who specialize in digestive health and disease issues. It's our mission to empower people like you to take control of your digestive health with confidence and optimism. Our objectives this evening are, first of all, to welcome you to this special presentation. We hope to provide each of you with practical, beneficial information that will help you maximize your health. Next, we want to introduce you to our expert, Dr. Richard Fedorak. And finally, we're here to answer as many of your questions as possible. The Foundation would like to thank AbbVie for partnering with us on this educational event. Without their support, this session would not be possible. We hope to provide each of you with valuable information that you can use to maximize your good health when speaking with your healthcare partners. Our expert this evening is Dr. Richard Fedorak. In addition to being the Associate Vice President of Research at the University of Alberta, we're fortunate enough to have Dr. Fedorak as our President at the Canadian Digestive Health Foundation. Dr. Fedorak received his medical degree with first-class honors from the University of Alberta in 1978. A recipient of numerous awards, research fellowships, and grants, Dr. Fedorak is a recognized expert in inflammatory bowel disease. He has an active basic gastrointestinal research laboratory, serves on multiple national and international scientific advisory boards, has published over 400 peer-reviewed manuscripts and book chapters, produced 2 patents on colonic-specific drug delivery, and has lectured around the world. Dr. Fedorak has served as president of the Canadian Association of Gastroenterology, the University of Alberta Hospital Medical Staff, the Alberta Society of Gastroenterology, the World Congress of Gastroenterology, and as General Secretary of the Pan American Congress of Gastroenterology. Now that you know a little bit about our expert, let's get started. Welcome, Dr. Fedorak.
Well, thank you, Catherine, and thank you everyone out there on TV and Internet land. Welcome to this conversation that we hope to have on inflammatory bowel disease. And I, too, wanted to thank our partner at the CDHF, AbbVie Canada, for their ongoing support and efforts to help us put out this information to you on inflammatory bowel disease. So we have a number of learning objectives that we'll discuss with you over the next 30 or 40 minutes. I want you to be able to understand IBD protocols. I want to establish why it's beneficial for you to participate in your own care and what that means. I want you to be able to understand the impact of what patients do not say. And when you're in that doctor's office, what being silent and what not saying things to your physician and the consequences that may have. I want you to learn how to get the most out of your doctor's appointments. As you know, we go into the doctor's appointment, and it's sometimes shorter than you like, and you need to be able to be prepared to get everything out of that you can. And I want you to learn what protocols to use relative to inflammatory bowel disease to maximize your health. So let's move right into IBD. Many of you on this broadcast tonight have inflammatory bowel disease, and for those of you that don't, it's a good thing that we review some of the statistics around IBD. As you may know, Canada has one of the highest prevalences and incidences of IBD in the world, surpassed only a few countries in Scandinavia. There are over 230,000 Canadians that live every day with inflammatory bowel disease, 10,000 new cases every year, and 20 to 30% of these people are diagnosed before they're age 20. So this is a disease that affects people in the prime of their life, when you're going to school, trying to get a job, trying to have a family. And it's expensive. In Canada, we spend over $2.8 billion a year on care related to inflammatory bowel disease. Not only that, it causes significant non-financial burdens to both patients and families and impacts quality of life, and reduces people's ability to work, attend school, and sometimes causes difficulty in relationships. So this is the bad news about IBD, but there is good news, and you can live a very happy, fulfilling life, staying well as long as you manage your disease carefully with your physician and healthcare providers. So let's move into a topic called IBD Protocols. What are IBD Protocols? For you, the patient, IBD Protocols are actions that you can take on a regular basis to keep you more healthy. And we're going to go through over the next 30 minutes what these protocols are. Without a game plan, what can you expect? So if you're not protocoling your IBD, if you don't have a plan on how to manage it, you're going to have decreased rates of remission. That means you're going to be sick more of the time. You're going to have recurrent flares. That means your disease is going to be active more often than it should be. You're going to be having an increased chance of infection and illness. With that goes an increased chance of surgery. If your disease is not under control, you have an increased chance of needing an operation in order to fix it. And of course, you'll end up with poor nutrition, you'll be underweight, and ill with all of the things that go with poor nutrition. So if you're not taking care of yourself, if you're not taking positive actions, this is where you may end up. So let's look at some of these protocols, some of the things that you can do to keep yourself healthy. I want to start with number one, adherence. This is a critical health strategy for you. Adherence is a big word. Doctors, when we talk about adherence, we are referring to following the instructions for medication and the lifestyle choices prescribed by your doctor or healthcare team. Most important, the medications. Taking the medications as described on a regular basis, not missing any, is not a choice. It's a necessity for those of you living with inflammatory bowel disease. This is a disease that you have for life, and it's important to get into the routine of taking your medications on a regular basis. The more medications you miss, the greater the chance you have of your disease flaring. The greater the chance you have of your disease flaring, the more likely that you're going to be sick and end up with surgery or other complications from inflammatory bowel disease. So adherence to medication helps you avoid that. Let's talk a little bit about flares and remission. So a flare of a disease, and you may have heard that term, you may even use that term yourself, is a time when the disease is active and causing you symptoms. Now, what you want to do by protocoling your disease, by taking action to manage your own disease, is to avoid these flares. And by avoiding flares, you're going to have a response, or a remission, as doctors will call it. So we want to get you out of a flare and into a remission. And a remission is an absence of disease activity. That means that the lining of your intestine has no more inflammation or very little inflammation left, and you have no associated symptoms. That means you're not going to have any pain, cramps, or diarrhea. And so the goal of IBD, the goal of protocoling inflammatory bowel disease, the goal of you taking charge of your health is to achieve and maintain this state of remission. So as we talk about this, taking care and taking control of your own care, it's important that we go through some of the things that we want you to do and some of the things we don't want you to do. So I've listed here some of the things that patients don't provide their doctors with. And if you can understand what to provide your doctors with, you're going to have a much better healthcare outcome. So many patients don't provide their doctor with an objective account of their health status. They come into our office and we say, "How are you?" and they say, "Fine." But they're not really fine. They may have pain, cramps, diarrhea, and they are off work. That's not fine. Be honest with your doctor. Tell them exactly what your symptoms are and don't minimize. Patients often don't tell us how they're feeling. You want to be strong. You want to appear that you have management of this disease, and you say, "It's not bothering me." Of course it's bothering you. It's making you depressed. You don't feel well about it. You don't understand why you have this disease. You're angry with the disease. We want to hear that. We want to understand that. We want to know what you're afraid of. If you're afraid of taking a medication because you think the medication is going to cause you a side effect, don't be silent. Tell me. Say, I don't want to take that medication. My mother said, my aunt said, my second, third cousin said it's going to cause this problem, and I'm not going to take it. Okay, tell me that. Let us discuss that fear. Let us understand what your fears are about the disease, the medication, the treatments, the diagnostic tests, and work through them. And then the questions you really want to ask. So don't be afraid to ask questions. There's no stupid question. All questions you have are good questions. And if you don't understand this disease as well as your doctors or healthcare team understands the disease, you're not going to do well. Our goal is to ensure that you understand this disease as well as we do. And these details are important. It's not okay to tell the nurse or family and friends about all these problems, but not your physician. Your IBD doctor needs to know all of these details. That's protocoling your IBD. That's taking charge of your health care. We don't want this disease to be a puzzle. We don't want you to come into our office and make us guess what the problems are. We want you to tell us what you think. We want you to tell us what your symptoms are. We don't want you to tell us what you think we want to hear. That is, how are you doing today, Mr. Smith? I'm fine, thank you. We don't want to hear that. We want to hear, I'm having pain, cramps, and diarrhea, and I'm not feeling well. My disease is flaring. But we also don't want to put words in your mouth. And we don't want to hear about your health issues from other sources other than you. It's very frequent a patient will come in to see us, have this discussion with me about how they're feeling, what their symptoms are, leave the room, and then tell my nurse that, well, I didn't really tell the doctor the whole story. The whole story is this, and here's some other things, but I didn't want to tell the doctor, so I didn't burden him with those things. The physician is there to hear all of this information. It helps us in treating you. The last bullet on this slide is important. We don't want you to agree with everything we say. If we tell you to take the red medicine because it's important for you, but you have a fear of that red medicine, you don't understand what that red medicine is, we want you to ask us. We want you to challenge us, and we want you to be able to say, I don't understand why I have to do that. Because when you understand as much as your physician does about your disease, you're going to do much better. Let's move on a little further into what your health team wants. So we've talked about what the doctor wants, what we want from you. We want you to provide us with accurate and complete account of your health status. And if that means you have to write it down before you come to see us, that's excellent. Again, we want you to be honest with us and yourself. If you're sick, tell us. Don't hide that fact. If the medication's causing you side effects, tell us. Don't hide that fact. And we want you to ask questions. Again, we want you to write those questions down. Come in with your list of questions. It's important that you have all of your questions answered. It's very easy in a busy doctor's office when you have so many things on your mind. If you don't write it down, you're going to forget. You leave the office, and you think, oh, I should have asked that and that and that. So write these things down. We want you to be your own advocate. And if you feel you need another advocate, that is someone to help you express to the doctor or the healthcare worker or the nurse what's happening, bring that person with you. And it may be a friend, it may be a brother or sister or some other family member. We want you to advocate for your health. I'm not getting better on the medication you're putting me on. I still have symptoms. I don't feel well. Someone to advocate for you if you can't advocate for yourself. And we want you to be responsible with and for your health. Again, we want you to be able to take your medications, be adherent, express when you don't understand something. describe to the doctor your symptoms and be able to describe any side effects that you might be having. There are responsibilities for being a good patient, and you want to get the most out of every appointment. I've mentioned this before. Be ready to talk to your doctor. Make a list. All the things you want to say, all the symptoms you have to tell them about, write it down. Keep a diary of your symptoms. This is really important. Your doctor, if you have inflammatory bowel disease, will want to know how many bowel motions a day do you have on the average, what percentage may have blood, what kind of pain do you have, where are your cramps. It's very easy to forget what happened to you this week, last week, the week before, the month before. Your doctor will want to know that. That longitudinal history is important. Have a complete and up-to-date of all your medications and surgeries. Just write them down. Keep a list. Bring that list in every time. Your doctor may or may not have access to all of that information, particularly if you've traveled from one province to another or another city. He or she may not have that information. Keep a list. Keep it in your purse. It's great to have as a reference. Take time to chart your disease out since it started. That's really important. Get on the computer or do it by hand. Just draw out a chart of when your disease was diagnosed, all the major events, including flares, medications you may have taken, surgeries you may have had. Just chart that out, put the years. That helps your doctor understand your disease. And again, as I said before, make a list of all the questions. Don't trust your memory, no matter how good it is, because you'll forget, and leave that office with not all your questions answered. So, I told you to track your history. Well, how are you going to do that? There are tools. The Canadian Digestive Health Foundation has designed tools for you. And here are two of the tools that track your symptoms, your medications, current and past, the food you eat, the exercise, your health history, vaccinations, and more. And one of these is an app called GI BodyGuard. And you see a little smartphone that we've listed there. You can download GI BodyGuard onto your smartphone right as we're talking. It's available for all Android devices, and download it. It'll track all these symptoms, medications, your health history for you. And if you don't have a smartphone, then we can get a paper copy. And I'm showing you a little paper booklet there. It's a paper passport. And you just email the CDHF, www.cdhf.ca, and we can get you hooked into either the app on GI BodyGuard or the passport so that this information can be tracked. It's an incredibly valuable tool for someone with a chronic illness like inflammatory bowel disease. Now, be ready to track your symptoms. So if you're tracking your symptoms on Passport, or if you're tracking your symptom on a smartphone with GI BodyGuard, we're going to ask you to record a number of things. And if you don't have those two devices, well, you can do it on a piece of paper. We want you to, when you have inflammatory bowel disease, before you're coming to see your doctor, record your number of bowel motions. And here's a little chart that you would see on the Passport or GI BodyGuard. The normal number of stools, 1 or 2 more stools than normal, 5 stools or more than normal. These are given points, and that'll help your doctor track your disease. Record the amount of blood. Streaks of blood, obvious blood, blood all the time, blood alone passed. Again, these are given scores by your doctor and will help them classify your disease and watch its progression as it improves, or maybe if it's worsening. Make these lists and bring these lists to your doctor. Of course, if you're doing it on a smartphone or in Passport, all of those lists are there for you to simply fill out. This is an important one. Be ready to describe your pain. So people say to me, oh, I have pain in my stomach. Well, is it mild, moderate, or severe? All of us have different pain thresholds. What might be mild pain for me is severe pain for you. So we have tried on GI BodyGuard and in the Passport to actually classify this pain. So let me just read some of these. Mild pain. What is that? Well, You're aware that the abdominal pain is there, but it does not interfere with your life, and you continue with activities such as work and pleasure. You feel and hear rumbles, gurgles, and cramps, but it's not interfering with life or work. Contrast that to severe pain. The abdominal pain causes you to stop all activity. You're frequently in bed because of the pain. You call in sick to work, and you cancel activities. So you can see how we've tried to give mild pain, severe pain definitions that we can apply in daily life. This will help your doctor understand your symptoms and help him or her focus better therapy for you. Again, these types of things are in GI BodyGuard and in Passport, and it will allow you to track that longitudinally over time. Your doctor will often ask you, and I've done several times using this as an example on this webcast, how do you feel? Well, again, each of us has different descriptors of how we might feel. And so, we've tried to classify these. And it's important. You might even choose to print out this slide or download it from our website. But you can see it's important that you be able to describe to your doctor what is very well, what is below par, what is poor, very poor, terrible mean. Because it'll mean different things to different people. Some people who are at work, functioning very well, never missing a day, might classify their well-being as terrible or poor. Whereas somebody else may say, I feel very well, or I only feel slightly below par. And so it's helpful to have these classifiers so that your doctor and you are on the same page when you say, I don't feel well, I feel very poor. Everybody knows what that means. And that's important for your doctor as they choose treatment and diagnoses for you. So we started out with IBD protocols. And we've gone through some of those types of protocols that you need to do, you need to take care of, and you need to manage yourselves. We want you to track your medications. It's very important for your doctor to know what medications you have been on, what worked, and what didn't. You may have inflammatory bowel disease already for 30 years. 20 years ago, somebody put you on a medication and it caused a side effect, or it didn't work. You want to have a list of that medication. You want to know that medication didn't work or caused a particular side effect. So when your new doctor today puts you on that medication, you can say to him or her, that medication didn't work 20 years ago. Do you think it's going to work today? Because your doctor may not have that information. That information may have been lost in all the medical records. You need to know that. You need to bring that to the office as you talk to your doctor. Similarly with your surgeries. Again, you've had this disease for a lifetime. The surgeries you had 10 or 15 or 20 years ago may not easily be accessible in your medical record, particularly if you've moved from place to place. And so you need to have a list of those surgeries and be able to give them to your doctor. Last bullet point here, make lists, exclamation mark, and bring them to your appointments. This is important. It's probably one of the most important things you can do is keep a current, ongoing list of your medications, your surgeries, and some of the key milestones in your disease. Know your disease timelines. It's not so hard on a calendar or on a spreadsheet, if you're computer-wise, to just list all your major flares, remissions, changes in medications, surgeries, hospitalizations, anything that you think is important for your doctor to know. It will expedite your visits. That means it'll make them quicker. It'll help when you go see a new doctor, and you have this disease for life. Inflammatory bowel disease is something that you unfortunately have for life, and you need to be able to track these over years and over decades. Your responsibility. IBD protocoling. Be ready for and with questions. I said before, no question is stupid. Write your questions down before you arrive. but don't have more than 5 or 6 questions. It's going to be impossible to answer 30 or 40 questions. You need to prioritize them and bring 5 good questions. And once those are answered on the next appointment, bring 5 more. Because having these answers to these questions will empower you to take control of your health with confidence and optimism. Now, how can you take control and be the super patient? Part of that is knowledge. Be an expert on your body, your disease, your therapy options, your health. Have your blood test done on time, often before your appointment. When you're making that appointment, ask the nurse, is there anything I can do ahead of time? Can I get my blood test done before I see the doctor so he or she has those results? And don't just live with your symptoms. Do something about them. See your doctor. Find out what's wrong. Find out how you can change that. And be compliant with your medication. The more medication you miss, the greater your chance of having a flare. So you may say, well, that's easy for him to say, but how do I become that super patient? How do I get all that information? Well, that's where the CDHF can help. The CDHF, Canadian Digestive Health Foundation, has a toolkit, has many toolkits. Go to that website, www.cdhf.ca right now, and you will find a whole host of tools that you can use and information that you can gain to keep your disease in remission and help you manage your inflammatory bowel disease. Let me go through a couple of these tools. Here's the web page. This is the home page for the Canadian Digestive Disease Foundation. And you'll see that there are symptoms that you can search on. So if you have diarrhea, write in diarrhea. It'll take you to a number of different sections in this website where you can gain information. There's fact sheets on various diseases, educational videos, personal stories and blogs from patients. There's also a section where you can put in your question and a doctor will answer your question. That's the Ask the Expert section. And there's news and research about new therapies and new modalities to treat your inflammatory bowel disease. And in fact, all digestive disorders are covered under the Digestive Health Foundation website. If you've got a child who has inflammatory bowel disease, here's a super cool video, Solving the Mystery of Endoscopy. So it's a fun and interactive online game video that helps young children, teens, and even adults understand what's going to happen when you are going to the hospital for an endoscopy. So when this webcast ends, log on to cdhf.ca and watch this video. I think you'll be amused, you'll get a chuckle from it, and it's very well done in explaining to children and even adults the processes and what happens during an endoscopy. Another tool from the CDHF is called Guiding Your Gut. This is a brand new resource that has been edited by physicians from across Canada and the Canadian Digestive Health Foundation. And it's created in a partnership with Robbie's Rainbow, another foundation that helps families living with Crohn's disease. It helps them understand the condition. It talks about the disease itself, proactive steps that you can take, many of the protocoling IBD items that we discussed today, benefits, risks, and even some of the financial insurance considerations that are so important to living with inflammatory bowel disease. Fact sheets. The Canadian Digestive Disease Foundation has dozens and dozens of fact sheets, not only on inflammatory bowel disease, but every aspect of digestive health that you can imagine. So you have a question, the CDHF can help you answer it through these fact sheets. They're downloadable and really valuable resources for you and your family to use every day. The CDHF is on Facebook, so if you have a Facebook account and you want to be online learning about digestive health, well, load in and log on to our Facebook account, and we'll provide you with ongoing up-to-date posts, friends, and sharing ideas and experiences, tell you about different events going on across this country related to digestive health. We have a number of contests and much more that you can find on your Facebook. Finally, I want to talk to you a little bit about GI BodyGuard. This is, again, a picture of GI BodyGuard on a smartphone. It's free to patients for both their iPhone and the Android. So, again, as we're talking here, you can download it for free and use it as a symptom tracker. Track your health, but also track your symptoms related to your digestive health for your doctor. Use this and you'll find it will really expedite and help your care from your physician. So the CDHF is also empowering from this recording, and there's many others on our website that are posted there for you to listen to relative to inflammatory bowel disease, but also many of the other digestive disorders that you may or your family may encounter over the years. In summary, life with inflammatory bowel disease, your actions impact your health. You need to be proactive, taking care of your health. Know your digestive history. Take your medications. Eat well. Lots of that information on the website. Learn to manage stress. Lots of that information on the website. Make regular visits to see your gastroenterologist and family doctor. That's key at a minimum of every 8 months. And stay informed and be as knowledgeable as your doctor and other healthcare providers. And I tell you that you will be a much healthier person for that. So thank you for listening. Now it's time for questions and answers. So this is your opportunity to think about any questions that you may have relating to inflammatory bowel disease or any other digestive question that you may have. And we have a group of experts here who will try and answer that question for you. So thank you very much for your attention.
So the first one that I have says, I'm on a biologic. I haven't had a flare in 3 years. Can I stop taking the drug?
Short answer, no. Long answer, maybe. And let me just put that into context. So inflammatory bowel disease is a lifelong disease, and if you're on a medication that's keeping you well, in general, your doctors are going to want to leave you on that medication for as long as it's keeping you well. On the other hand, there are some medications, and there are times in which we may want to what we call de-escalate or withdraw some of your medications. And you'll need to speak to your doctor about how and when that can happen. But the general answer to that, Catherine, is if you're on a medication and you're staying well, we're going to leave you on that medication.
Okay, great. The next question is, it says, if I'm seeing my gastroenterologist regularly, do I still need to see my family physician?
Yes, absolutely. So your gastroenterologist is going to manage your GI tract, but we still need you to have a family doctor that you can access quickly and manage many of the other things that may occur in your life. So you may have a cold, you may have a chest infection, you may have a urinary tract infection. Those things need to be treated and seen quickly, particularly if you're on immunosuppressive medications for your inflammatory bowel disease. And it's not always so easy to get in to see your gastroenterologist. And so you need a team, a family doctor, along with that gastroenterologist to treat your inflammatory bowel disease. But excellent question, Catherine.
The next one says, I miss a lot of work when I'm struggling with a flare, and I'm afraid about losing my job. Is there something I should be asking my doctor to do to help me, to help my employer understand my condition?
Yeah, that's a really good question. That applies to kids in school and people in university and people with jobs. In general, we don't want you to have very many flares. We don't think that you should be missing work or school. We would want you to have a good quality of life and be in remission. So if you're missing a lot of work because you're having flares of your disease, you need to get back to your gastroenterologist and speak to them and say, I'm having too much disease activity. I need you to help me get my disease back under control. That's number one. The other is more sensitive, and it's a case-by-case situation. Patients need to be able to know whether or if they can speak to their employer or school teacher about their disease. And there's certain times when it's important to do that. But I'm of the sense that you need to discuss that with your family and know the situation that you're in. You may choose not to discuss whether you have inflammatory bowel disease with your employer or with the school. On the other hand, if you think it's going to be advantageous that those people know about your disease, then feel free to discuss it with them. Clearly, if you're asked, you'll need to discuss that with them, but I think that's something that you will have to decide on a case-by-case basis.
Okay, great. This is a question from a mom who says, I want to try and reduce the number and severity of flares that my daughter is having. Is there anything that I can do with what she eats to manage that?
Yeah, that's an excellent question, and we get that all the time. I do think it's important, particularly for children who are growing with inflammatory bowel disease, that they see a dietitian. We want children to have the best possible diet. We want the dietitian to help and work with the family so that if the child says, well, every time I drink milk I get more stomach pain, the dietitian can help find solutions around that so the child continues to get the calcium, vitamin D, and that they may be missing by not drinking milk, as an example. In general, there's no one food that's going to cause a flare, and there's no foods that are going to make the child have their Crohn's disease or ulcerative colitis go away. But there are foods that will trigger symptoms, and again, a dietitian can work with the parents and the child to identify what those foods are. So a long-winded answer to really say working with a nutritionist, a dietitian is important, and unfortunately there's no single food that's going to make this inflammatory bowel disease go away.
Okay. And again, lots of questions about flares. I'd like to know what specific questions I should ask my GI about how to manage flares. Is there something that you can suggest or questions that you can suggest I ask?
So first of all, you shouldn't be having flares. We want you in a long-term remission. So your question to your doctor should be, how do I get into a long-term remission? What medication might I take? What should we do in order to get me into a long-term remission? That's the question I'd want them to ask their doctor if they're having lots of flares.
Great. Perfect. I am wondering if you can provide me with some suggestions on how best I can manage stress.
So again, Catherine, that's a really good question. We get asked that all the time. It is true that when people are under a lot of stress, that it can make GI symptoms worse. It doesn't make the inflammatory bowel disease worse, but it makes GI symptoms worse. And everyone's aware that when people get under a lot of stress, really nervous, sometimes people get nauseated, some people feel queasy in their stomach, some people can have diarrhea when they're stressed. So those are normal body reactions to stress. And people with inflammatory bowel disease can have some of those same symptoms associated with stress, and they can interpret that to mean, oh, I'm under stress, my IBD is getting worse. It's probably not your IBD getting worse. Your body's functioning normally and giving you some of those symptoms. So that means that it's important, I think, to manage your stress and learn coping skills in order to manage this chronic disease. And I think that those are hard to do by yourself. So, Catherine, my advice to patients is this is where a good family doctor can come into play for you. I've got a lot of stress, I'm not managing it well, and I don't have any good coping skills to help me manage this. I'm going to go see my family doctor and ask them to see whether they can help me see a psychologist or at a stress clinic or an expert who can give me some guidance. I think this is very important. And certainly your gastroenterologist can help you with that, but a family doctor who probably knows you better and knows some very good stress management teams in your area is the person to go to. So I, Catherine, want people to try and seek some professional assistance in this regard rather than just trying to manage the stress themselves. if after a few weeks or months they find that they're not able to control that stress.
Okay, great. And going through my head as I'm listening to you is that managing this disease is really done by a health team. It's not just a gastroenterologist. There's others that you can bring in to make sure that you have the best possible life as you go through your journey with the disease.
Oh, yeah, Catherine, that's bingo. That's right on. Use all the resources that are available to us in modern healthcare. We have nutritionists and dietitians and pain management people and psychologists, all of which are available to you. And that's, again, why you need to advocate for yourself, why you need to be truthful with your doctor and say, I'm just not managing my stress well. Is there somebody that can help me with this? That's critical.
Okay. The next few questions are all related to biologics, so I'm just going to go through with them. And they're somewhat related, but they're a little bit different with each one. So the first one is, I've been on Remicade for 7 years, and it's starting to lose its effectiveness. What other options do I have?
Yes, we should just explain to the audience that biologics are a class of medication, and these are manufactured proteins that we use to treat inflammatory bowel disease. Humira is a trade name for one of those. Remicade is a trade name for another one of those, and we use these biologics to treat not everybody, but some cases of inflammatory bowel disease. And now, Catherine, after I said that, I forgot what your question was. So could you repeat that question now that I explained biologics?
That this individual has been on Remicade for 7 years and it's losing its effectiveness. So what are the other options that they have?
Yeah, for sure. So one of the things with these biologics medications is they can work for a while and then you can become resistant to them and they lose their effect. And so we would switch to another biologic. Your doctor would want to do some tests, maybe determine whether your disease is more active, whether you have an infection in your intestine, and then switch from Remicade to another biologic, and in this case to Humira. And again, you'd have an excellent chance of regaining back that remission on the new biologic medication.
Okay. And this one, I think we've answered it, but I'm going to ask it again just to make sure that it's really underscored how important it is to stay on the medication. The question says, my son has Crohn's disease, and I'm not sure how long he will have to stay on Remicade. What can happen if and when he stops getting it?
Well, as I think I mentioned before, your son is going to be on Remicade for a long period of time. And so we would probably not want him or her to stop it because he's very likely to have a flare. And if there was going to be a stoppage, we'd want that to be done in good consultation with a gastroenterologist who is familiar with your son and with the patient, so they could make a really informed decision. But in general, we wouldn't stop that medication.
Okay.
But Catherine, it's important to make another point here for the audience, that is these medications, as all medications, are expensive. It's important that people have proper medication insurance. Medication insurance across provinces is different, and they need to understand that and know that. Medication insurance also changes as a child goes from being under their parents' coverage to their own coverage. And so it's really important that parents be knowledgeable about that with their child and make sure that they have proper medication insurance and that they have proper medication insurance themselves as they move from job to job or place to place.
And that's a perfect segue into the next question, although I'm not sure that you will be able to answer it, but I'll put it out there and see what you can say. And it asks, will there ever be a reduction in prices for the expensive medications such as Humira and Remicade?
Yeah, unfortunately, it costs a lot of money to make some of these new medications, and so for the time being, these medications are expensive. We are extremely fortunate in Canada that our healthcare system is able to afford these medications, and patients all across Canada are benefiting from all of the available medications for inflammatory bowel disease, and we're fortunate in that way. These biologic medications have been transformative and have really helped many people who in the past would have ended up having surgery or not being able to go to school or work, and now they're able to maintain a normal life. So it's the treatment for inflammatory bowel disease certainly is improving every year, and we're really encouraged by that.
Wonderful. Yeah, we never know what's in the future. We have a new question here that says, does a liquid diet alone cure a Crohn's flare-up?
Good question. A simple liquid diet like you might think of, which would be juices and things of that nature, won't cure it because you become malnourished. But in the pediatric population, we can use what we call enteral feeding. So that's providing all of your protein, fats, carbohydrates, vitamins, minerals in a liquid form, often by feeding tube into the stomach, and that will put your disease into remission. It's used in pediatrics to avoid some of the medications that can have side effects in pediatric patients. It's not used very often in adult patients. But that's a very special type of liquid diet. The standard liquid diet that you could mix for yourself at home would not put your disease into remission.
Okay, great. And a quick question, is there any tie between Accutane and developing inflammatory bowel disease?
So there is lots of discussion around this, but probably yes, there's evidence that using Accutane can either trigger IBD that you already have, or maybe perhaps trigger it earlier than it would have normally come in you. So I think it is something that you need to be cautious about, particularly if there's a family history of inflammatory bowel disease, for a young person to use Accutane.
Okay. And here's an interesting one, and I know I've heard you and some of the other members of our board discuss it, so it'll be interesting. It's interesting that it shows up here, is that it says fecal transplants for the treatment of UC are gaining popularity. Despite the lack of clinical trials supporting this, what are the general attitudes of gastroenterologists and scientists regarding this?
Fecal transplantation you're talking about, Catherine, is that correct?
Mm-hmm. Yeah.
Yeah, so I should just explain. Fecal transplantation is a new experimental tool, and it is taking fecal material and the bacteria in that fecal material and putting it inside from one person and moving it into another person, usually administered by colonoscopy or enema. It's an experimental tool for inflammatory bowel disease. You shouldn't be using it for inflammatory bowel disease outside of a major research center. It is used in some other sorts of infections, but not yet any close to standard of care for inflammatory bowel disease.
Okay, great. And we're just about out of time, so I think we'll just take a couple of more questions. So the first one is, I hear conflicting reports on whether or not I should have my teenager who has Crohn's vaccinated. How do vaccinations impact the health of those who are living with IBD?
Everybody should be vaccinated. You should have your teenager vaccinated. You should be vaccinated. And anybody who is starting any medications for inflammatory bowel disease should be vaccinated. We don't want you to have any of these infections while you have inflammatory bowel disease. We don't want you to get these infections while you are immunosuppressed on biologics or other medications. So absolutely, vaccination is mandatory. Okay, great. And the last question I'm actually going to answer because it's an easy one. It says, how can I get a copy of the passport or get information about the apps that we talked about? So the app is called GI BodyGuard, and it is available now for the iPhone and Androids. So if you, after this session is done, if you just shoot me an email at director
at cdhf.ca. I'll make sure that you get either the passport, which is the paper-based version of tracking your health history, or the links on our website to go directly to GI BodyGuard so that you can download it for free. So this is going to be just about the end of our session now, and wanted to thank, on behalf of the Canadian Digestive Health Foundation, Dr. Fedorak for sharing his insights and expertise as a physician who sees IBD patients on a regular basis and does research in IBD. We'd also like to thank AbbVie for funding tonight's event and making this educational session possible. And, of course, we want to extend our very special thanks to you, our audience, for joining us. We hope you enjoyed the session and that you feel empowered with a better understanding of protocols you can implement to maximize your own health and help you live positively with inflammatory bowel disease. Please remember to visit cdhf.ca under our resources section in the near future to review this session and others that we've recorded for inflammatory bowel disease in the past. So again, thank you very much for joining us this evening, and hopefully we'll be connecting with you again soon.